A 24-year-old woman presents to the emergency department with severe abdominal pain since last night. She also complains of scant vaginal bleeding. She says she visited a physician last year who said she had a pelvic infection, but she never took the medication prescribed due to cost issues. She also says her period has been delayed this month. She is febrile, her pulse is 124, her blood pressure is 100 over 70. On examination, her abdomen is distended and tender, and a pregnancy test was positive. A complication of infection with which of the following organisms is most likely to lead to the patient's condition? So is it Candida, Neisseria, Chlamydia, Mycoplasma, or Haemophilus? Well, it was a case of ectopic pregnancy, and the underlying cause was PID. So what you need to recognize is what would be the most probable organisms for PID. So this woman came in with severe pain abdomen, and she complains of scant vaginal bleeding. And the thing to pick up here was last year she had a pelvic infection, didn't take medication because of cost issues. Her period has been delayed, and her pregnancy test was positive. So the fact that her pregnancy test is positive and she's coming with severe abdominal pain and vaginal bleeding, all of this is pointing in the direction of an ectopic. Now we know that she had a pelvic infection which was untreated. So she had an underlying PID. So a complication of infection with which of the following organisms was the most likely cause? So you need to know the most common organisms for PID, and then your answer would become simple. Okay, so this patient's history of delayed menstruation, clinical features of abdominal pain, low blood pressure, rapid heart rate, and a distended tender abdomen with a positive pregnancy test is highly suggestive of a ruptured ectopic. Given that she has a history of untreated pelvic infection in the past, it is possible that this occurred as a complication of PID. The most common organisms for PID are Chlamydia and Neisseria gonorrhea. Okay, and what is PID? It is an infection of the pelvic organs caused by bacteria in the vagina and cervix that ascend into the uterus, fallopian tubes, and ovaries. And chronic inflammation can result in scarring and fibrosis. And because of this, patients have a higher rate of ectopic. And that's what was happening in our patient. She had a past infection which was untreated. She developed chronic PID. She developed scarring, fibrosis, which led to an ectopic pregnancy, which has now ruptured. PID should be aggressively treated with antibiotics. Now, the answer, it could have been Neisseria, it could have been Chlamydia, but Chlamydia is a more common cause for PID, and that's why we're picking that in this answer.
Thanks for watching. Please give a thumbs up and subscribe for more.